On Wednesday, Parliament passed a health insurance bill that would require every employed Ugandan to contribute to a national health insurance scheme. According to economist Dr. Fred Muhumuza, the health insurance law will not improve service delivery in the ailing healthcare sector.
And the economic benefit is going to be marginal. Because where this money is going, we already have donor money which has been there, tax monies which have been there, and the corruption in the system is what we are adding this onto. We are just coming out of the COVID conversations where private people genuinely put their money in, and the return of the messages that came out, the truth is never going to be known, but certainly there is clear evidence that there was a lot of corruption. Now, with the health system running that way, I think we needed to first resolve the institutional frameworks.
However, some civil society activists who have been pushing for the bill argue that if passed into law, many people, including the poor, will have access to health services, translating into a more productive population.
It's going to stop a lot of people, especially people in the informal sector, the poor, from using their own assets to access services. Because right now, many of them, if they need medical services, they have to sell some asset or property or some food crop in order to go and pay for medical services.
You already see that government had some resources adequate enough to improve the healthcare system, and they failed to do that. Now you cannot say, but when the health insurance money comes in, what has failed over the years will now work.
Makaire argues that the law will further reduce on the out-of-pocket burden for most Ugandans.
WHO recommends that at least people should not spend beyond 15% of their income. And right now we are at 42%, so that is going to reduce. The number of people who fall into poverty as a result of incurring catastrophic health expenditure, which currently stands at 10%, will drop.
In the bill, the poor people are supposed to be paid for by the government, but the question would be how government will determine who is poor or not without abusing the facility.
Rwanda, and Rwanda has a similar experience. They regularly define who the indigents are and the poor, and the government supports them. But in Rwanda, it is done at a community meeting. So community members know each other. They know who exactly is an indigent, who can afford something and who cannot afford something.
Dr. Muhumuza highlights what needs to be done.
So for me, the best way to start on this program would have been, can we first streamline the healthcare services so that you are charging people on a system that works now.
Although the bill was passed by Parliament, the Ministry of Health still insists they were not ready for it.
The government, we decided to withdraw the bill, consult widely, then come back with that bill when we have made enough consultations. To me, I think I distance myself from yesterday's bill. Yes, in its current form, including my ministry and cabinet.
Previously, the President had asked Parliament to halt debate on the bill after he was petitioned by some investors who claimed paying for workers' medical insurance would increase the production costs.
What remains to be seen is as to whether the President is going to assent to this very bill that is already considered as a bad law according to the line ministry. And also time will tell as to whether the same Parliament will remain with the same steam and spirit that they have exhibited while passing this very bill. Because in the future, in case the bill is sent to the President 3 times and he does not assent to it, it can still be passed into law. Sudibya Ruhanga, NTV Kampala.